This
It's just
conference will now be recorded.
so it's interesting. It's just, you learn as you go.
You do. And oh, we have someone else who joined us. Yes, Lorraine, you do. And if you want to tell everyone where you're, where you live, what state, or
Oh, I'm in New York State, and I'll be 55 this year.
young.
And I have 2 grown kids, 27, 25. They're out on their own. My son's actually in Colorado, and my daughter's in New York with me, in a separate home.
Is she close by?
Yes, she's in the same town. So it's nice I get to see her, but my son is in Colorado because he's working on his PhD.
It's very nice, PhD. And so, Lorraine, welcome. So we have people with various blood cancers here, as I had explained before, and we generally have the new people introduce themselves first, and then if there's anything that by others introducing themselves that inspires you to ask questions or share, please do.
Thank you.
And welcome. So who just joined? I have to apologize. First of all, I need new glasses and I am having difficulty. I don't know. I think it's better without my glasses to see actually at this point. There you all are. Oh, you're who just joined us. I can't, with my glasses, I'm having problems reading and seeing things on the screen. So sorry about that. Al, thank you for joining us tonight. You're looking like you got your hair coiffed. Good. We think maybe Rick is having his done right now.
It's all about the fashion.
Yeah, I decided to go kind of beachy today. Bohemian is my husband says, boheme or bohem. So I know that Ashley, I don't know if you spoke with Farron or not. So Farron, I'm not sure if she still is in the hospital. She was in the hospital. She's starting treatment again tomorrow, and she may join us by audio tonight if she feels up. So she's had, I know she invited some other AYA members, and she was unsure if they, some of them couldn't make it. She was unsure if others would be joining. So Ashley, I'm unsure if you'll know them when they join, if they do join tonight. So I welcome you, if you know them, to welcome them with us. So yeah, Farron, it'd probably be good for anyone to give her a shout out who knows her. So Farron is those of you who have been with our meetings, Farron is our AYA member here, tried and true. She has Hodgkin's lymphoma in a very rare form, and she lives outside of Atlanta. So best wishes to her. She starts her new treatment for her. Now we do have someone else new. If there's someone new with our group, we'll have them go next. But let's just see how everyone, if anyone has anything tonight that they came to the meeting and really want to share. Perhaps something has changed in their status. Perhaps they're starting treatment or just started it since last month or since the last time they checked in. Is there anyone who would like to share about that? Susan, did you just start treatment? We can't hear you.
Not yet.
Okay.
I have to wait for, as I mentioned earlier, I had my second COVID shot on Friday. So I have to wait 2 weeks. I did call my gal at Cancer Care, and she hasn't gotten back to me yet. So I expect I'll get a letter for appointment for blood work in the next 2 weeks, and that's about when I should hear. And as far as I know, it's still going to be Gaziba and chlorambucil. I really wanted to take Tom's advice and go with the venetoclax, but it hasn't, I don't know what happened. It didn't get approval. So although the gal I talked to said it is possible that by the time I have treatment, like in the next 3 weeks, it's possible that the venetoclax might get approved.
So for those of you who don't know, Susan's in Canada.
So,
So
and
it's,
venetoclax is pretty new here.
One of the things that's really, makes it a little different is that, every country has a different approval process, and, so Canada kind of lags behind. Interestingly enough.
Every province too.
Yeah, and interestingly enough, I got asked by CLL Canada to offer an opinion. They were asking everybody to kind of like send in an email of why a certain drug should be approved, and I think it was one that that Ashley's on, that Chiquiva or whatever that drug is that you're taking, Ashley, but it was to get that approved. So, I did respond to that, and it said that you didn't have to live in Canada to give your opinion, but it's a whole different approval process in some countries. So we often assume that the same drugs are available everywhere, and they're not. So
is anyone else, I don't think so, here tonight, living in another country with us tonight, or Canada, another country, same continent,
another country.
same continent, different country. I do see someone else just joined us who I believe is new, who, Debbie, is that Lorraine, is that one of your friends who has joined us
No,
tonight?
her name's Kim.
Okay, someone else is here. Debbie, I don't know if you can hear us, but you're muted. We usually have new members say hello first and introduce themselves if you would like to, but if not, that's okay too. So if you would like to just.
Can you hear me now?
Yes, we
Aha.
can't see you, but we can hear you.
Can I add, Michelle, can I add something that I did today?
Please.
That might be helpful to people. I know I'm a newbie here, so maybe all of you already know this, but maybe not. So I went to the Leukemia Lymphoma Society.org website, and it seems that they have a partnership with Subaru over the last 6 or 7 years where they send out blankets. Are you guys familiar with this?
Yes.
They said, yes. So they're going to send me a blanket. I'm excited.
it's
You
an
might have noticed
amazing
I started
blanket.
the meeting with a long sleeve shirt on because I have trouble regulating my body temperature now with this CLL. So I'm hot, I'm cold, I'm hot, I'm cold. That blanket's going to come in handy, And then I also signed up for a free consultation with a dietitian. So I thought that would be interesting because I'm already doing quite a few things, but I'm always interested to hear, so this is nice. It's a 30-minute free consultation. So I would encourage anyone who hasn't looked into this to maybe look at it. It could be helpful, right?
Yep.
This is LLS? Is this your local?
LLS.org, yeah.
That's great. That's great information. Be interesting what they tell you about nutrition. Has anyone done the nutritional counseling with them here? Yeah, I'd be really curious about that. So Debbie, would you like to, I don't know if you were going to show yourself or not, but where are you from and what brings you here?
Hello, I'm from Santa Barbara, California, and I just got diagnosed in January, just after my routine yearly physical. I'm 67, and my white count went up to 18. So I saw an oncologist, hematologist, and he said, well, you're going to live another decade and you're not going to need any treatment now. We're just going to be watching you every 4 months. We'll check your labs. And so this is a hard thing, was that you've got this disease and you know it now, so you have to live with it.
You have, and which, do you have CLL or a different leukemia? or
No, I have,
lymphoma.
I have CLL.
I figured from what you were saying on the watch and wait, the dreaded wait and worry, or watch and worry.
Right.
So
Well, Debbie, I'm betting you'll live to be in your 80s.
Thank
if
you.
not older,
I was
Uh,
60. I was 67 when I was diagnosed, and I think I'm gonna make it for another. And that was back in 2013. I'm planning on hanging around for another 10 years. When I die, I will still have CLL, but I'm gonna die from something else. It'll probably be Alzheimer's.
oh, yeah.
I think from too much ice cream at the Denny's. That's,
Somebody's been looking at my Facebook.
well, Lynn, we were talking about, you had the picture about I asked you where the Denny's was. Lynn told
Yeah.
me what we have in my city, but it's not in my end of town, so,
No. Okay. Yeah. It's on the other side of the tracks.
yeah.
yeah, ice cream is good for most things, I find. That it's good to
Especially when
know.
it's 30 Celsius.
You know, the interesting thing for me is that I've been a hospice nurse for about 20 years, and I've never taken care of somebody with leukemia who was dying. So I asked another friend of mine who has been an oncology nurse, I said, "Well, why haven't we seen people with leukemia?" And she said, that's because they die in the hospital.
Well, we all like to think that not of that happening. There is, of course, that can happen, I suppose, but a lot of the so there's so many different kinds. If you're a nurse, you said there's so many different kinds of blood cancers,
Right.
and everyone here is proof that we're all here still talking about it. And yes, I hope that you don't have to worry about that for many, many years, nor to any of us. But although, the worries still do creep in, especially at the beginning when first diagnosed, I know. And I go in and out of it myself. How about, so Debbie, is that, you studied up as a nurse probably then about all this, it sounds like.
I have. And the other thing is that I have complex orthopedic problems because of a car accident when I was 16. And I'm going to have a hip replacement on the 10th. And that was something I wasn't sure if I could do. And they said, no, go ahead and do it now. So that feels sort of challenging this time. I had the other hip done 16 years ago and it was a breeze. So I'm hoping this one will be easy too.
So I had my hip replaced actually while I was on treatment for CLL. And all we did was taper down on the ibrutinib that I was on, which does act as a blood thinner, like 6 days before my treatment, and actually started it right back the next day because they were going to put me on aspirin, and I said, no, put me on my cancer medicine. So I really only missed 3 days of having no medication on board. But yeah, there's no reason why you shouldn't get anything done medically now, before the time that you need to have treatment. So, go ahead and proceed just as long as your CLL doctor is aware, and they'll let you know if there's any precautions that need to be taken. So.
And the
Debbie,
only
I
thing-
had my knee replaced while on treatment for multiple myeloma. And the same thing that Thomas said, they changed the blood thinners, and that's about it.
Yeah.
Okay, well, that's encouraging.
Debbie, this is Rick. You and I corresponded a little bit, and you are going to notice such a huge difference from the anterior than when you had your last hip done. I mean, if it
My
was,
last trip was anterior also.
oh, it was 16
Yeah.
years ago.
Yes.
Oh my gosh, you must have been the first ever person to have it done anterior.
No, it was a doctor who had studied in England, and he had a special table built, and he was one of the only guys here who did it. So
Wow.
it was
Where did you say you are in California?
in Santa Barbara.
In Santa Barbara.
Yeah.
Wow. Wow. Well, I mean, it's interesting because my goddaughter and her husband are both studying to be orthopedic surgeons, and they didn't even know about in England, and they didn't even know about anterior. I mean, when I had it done, they were really curious.
Yeah, it's a lot easier than posterior, I think.
Wow.
Debbie, I'm in Santa Barbara as well.
And where are you? I'm looking at these people.
The
Sally.
waving hand.
See if I could.
Maybe you two are neighbors and don't know
I
it.
know,
Who do you have for your doctor?
Dr. Newman.
That's who I have. Yeah.
And you have two different blood cancers.
And we have 2 different blood cancers. He's only got 3 of me.
So I thought there was only one of you.
Oh, there's only 1 of me personally, but he only had 3 cases of MM.
I see. I don't know.
That's
I'm
why I go to
wondering.
City Pope. What?
No, I was thinking of Dr. Newman. He probably says, "Thank goodness there's only one of those Sallys."
No, he actually gave me a compliment the last time I saw him, which was about 3 months ago. He says, I don't know if I can take too much more of you. I'm learning more about multiple myeloma than I need to.
Oh,
You're helping teach the doctor
There you
Right.
go.
from the patient's perspective. Good for
Wow.
you.
Wow, wow, wow.
So you chose the same doctor and live in the same city?
Yeah.
That's
Yeah.
maybe in the chat, if you wish to, you can exchange information. If
To give you an idea, the city isn't that big.
no, not.
There's 1 cancer center.
Yeah. What's the population of Santa Barbara now?
If you want Santa Barbara County, it's probably 150,000. If you just want Santa Barbara, it's probably 100,000.
Yeah, I was going to say around 100,000. It's big enough. Yeah, it's big
Yeah.
enough. So, but that's cool. I mean, we have in some of the calls, we have people going to the same doctor, but a lot of times that's because they've been referred by one person to another. So, but that's pretty cool that we have 2 people going to the same doctor from Santa Barbara. I like that.
Yeah, I know. That is very cool. Welcome, Rick. And we have Kenny here.
Hello, Kenny.
Hello, Kenny. Oh, that's me. Hi, Rick. How are you?
Everyone keeps changing positions on my screen. I feel like I'm playing a game of chess or something.
Yeah.
No, that
you
was
know,
just me. I decided to move around.
It's
It's a
not,
poor connection.
no, it's difficult to moderate these calls by looking at people on the screen. I know that because they're not in the same place, and people say, oh well, I'll go around the screen, but you can't do that. You have to write the names down and then call them out from experience. I know that that's how you do. And maybe we should just tell Debbie, there's a little bubble in the top right, Debbie.
Uh-huh.
That window. And if you click on that, it'll open up and you'll see there are some messages there for you even. And so I think, and Lorraine, that chat window, there's a lot of information that gets exchanged there.
Thank you.
I keep getting notices that the connection is poor, so.
That's local. I mean, and when you do get that, that has to do with you locally. That's not.
I don't doubt it.
I get that a lot because I live in the middle of nowhere. So, but Michelle, maybe you want to just check in and see who would need some time today.
Yes, we started doing that, and we ended up getting some new members here. So actually, I would love to hear how Al is doing.
Well, I was having to do lab work every 2 weeks, and they've changed it now. My numbers are better. I'm having to go now once a month, and I've had, I believe, 4 phlebotomies since December, and I think they're starting to spread out. So it's a good sign. And Tom, you sent me an email link on a trial at Mayo. Thank you very much.
You're welcome.
I did talk to the nurse practitioner over there, had a video conference with them, and I did bring that up at the very end, and it's over. And they're going to go ahead and put me on the list once they start it again.
Great.
And we'll go from there. And then again, if I qualify. And
Yeah.
so I've been doing okay. My symptoms are lighter. I still have the same symptoms, but I'm able to function a lot better than where I was last year at this time. And again, since I'm talking, I got a question for Henry. One of the things they brought up was for me to stay out of the sun with the hydria.
Yes.
And I live out here in southern Arizona. It's 102 today. We're in the middle of summer now. By them saying me staying out of the sun, I mean, I'm not going to get suntan. I don't need to.
Right.
But if I go out, am I safe with wearing long sleeve shirts? I mean, how much do I really have to avoid the sun?
So what you have to worry about is what's called a photosensitivity reaction. So a lot of times what those are is that you actually develop a rash. So by covering as much of your skin as possible, you really reduce the risk. So if you're wearing long pants, long sleeve shirts, and maybe a ball cap or whatever that shades your face a little bit, you should be okay. But any exposed areas, an SPF 30 or better, serves the same purpose and actually protects you. So that's always the caveat that I give, for those of us that live in the hotter climates like you and I and Lynn in Texas, and where we're out in the sun all the time. You just put on some sunscreen and that helps with all of that. So there's a lot of medications, and hydria is one of them that get a photosensitivity reaction. So, and I wish you luck if you can get into that clinical trial. And I think for people like Debbie that's just joining, I think it's important for people to know that when we talk about clinical trials in cancer, we are not talking about being compared to placebo. So like with the COVID vaccine, you got the vaccine or you got placebo. With cancer, you never get a placebo. That's considered to be unethical. So what you would get is, what is a current standard of care? So what is an approved treatment now that we can compare a new treatment to? And, so when I sent information to Susan about the venetoclax obinutuzumab compared to the combination that she's going to go on, there was a superiority with the venetoclax, but they only compared it to an approved therapy. So, that's really important for people to understand. Any cancer, they never use a placebo.
Good, I didn't know that.
Yeah,
Thank you.
yeah.
And also, well, I was on a clinical trial. If you're on, and Tom, you can speak much more eloquently on this. If you're on a phase 3, that would be
Phase 3,
safer than a phase 2 is going to be safer than a phase 1, just because
Right.
they've been tested in, phase 1 is, the higher up you progress in the phase number, the more it's been tested and in the progression of the testing.
Yeah, so what happens with clinical trials is that before we even try it in humans, we try it in animals. So that's called preclinical. And then phase 1 is usually a very small number of patients, maybe 30 to 40. And what we're trying to do is determine what's the safe dose. And, so they will gradually increase the doses to get the maximum effect with the least amount of side effects. And so when they get to a certain level of side effects, then they back off. And then phase 2 is once they decided what that safe dose is, then they use it in a larger number of people to say, okay, do we get the effect that we want and do we still maintain the safety? And then phase 3 is usually numbers in the thousands, of patients that are involved, the high, probably 800 or above in a phase 3, the COVID trials, the phase 3s were 75, 80,000 people in those trials. So phase 3 is the highest. And then there's actually a phase 4, which is after the drug's been approved, they continue to do studies on the drugs for safety and efficacy. So it's pretty involved. So yes, a phase 3 trial is the safest trial, to get into, if you have that option. And I think with blood cancer today, we're really, really fortunate that we have so many new options coming down the pike and so many combinations of drugs. So I got diagnosed in 2015. And because I'm a 17p deletion, chemotherapy wouldn't work in me. So the only targeted therapy that was available in 2016 when I needed to be treated was ibrutinib. So it was a pretty easy choice. I was going to go on ibrutinib, and now there's all these clinical trials with combinations. So I recently looked it up, and just for CLL, there's over 1,800 clinical trials currently going on worldwide for CLL.
Can you say that again? How many?
1,800.
Wow.
There's a website called clinicaltrials.gov, and it allows you to put in the condition. And then if you want to search for a drug or a country or a state, you just put in that information and you can actually find a clinical trial for your condition. So it's pretty interesting, but I've done that and just put in CLL, hit the button, and it's like 1,838 clinical trials right now going on. So it's
Tom, would you comment on the type of medical facility you need to go to participate in the clinical trial?
It's interesting because, some of them are, I would say the majority of them do occur in academic medical centers, but there are some community practices that do participate. And so when you pick a clinical trial, there's a box within that clinical trial that says locations. And if you click on that, it tells you where is that clinical trial being conducted. And so it could be here in Florida, we have community practice called Florida Cancer Specialists. And so they do a fair amount of research, but they're community located. And so they have sites all around the state of Florida. So it's just a matter of finding, a site near you and, just determining what's going on. You know,
So I'd like to just say something.
so we've
I'd like
talked.
to say something. I'd like to say something on that. More and more, what we're seeing is that the community oncologists are affiliated. So there are 2 or 3 groups that, even though they're independent groups within certain states, they're all linked together. So US Oncology, for example, is really a bunch of separate and independent practices that are loosely affiliated, and they can buy their supplies through the affiliation, and a lot of times they affiliate on trials. So when you go to clinicaltrials.gov, which is really the master list, you'll see locations, and you click on those locations, and a lot of times those locations might be all over the US and overseas. And if it involves a community practice, then it's usually, say, a US oncology trial where they're running it in all the states where they have these separate offices, so Arizona Oncology and California Oncology and whatever it might be.
Yeah.
So you'll see that more and more across the board. But the easiest way to access trials is usually through a center of excellence and through talking to your doc who's at a center of excellence, but not necessarily. I just want to come back to Al's trial, because I think Al didn't explain what the trial was. And for people who are on this call, Al has a blood cancer called polycythemia vera, PV, which means that he makes too many red blood cells. And so every so often, he has to go and get his blood drawn, basically. And they just pull out a volume of blood, I don't know, a pint, 2 pints, whatever it is, and that brings the amount down. Now, the trial is suggesting an oral pill that can be taken, I guess, on a daily basis that can do the same thing. So he would not have to go to get his blood drawn.
So is anyone else here on a clinical trial? Just curious.
So Seth, what are you on? You're muted. There you go.
I'm on a combination of Nevo and Dara, and also pomalidomide. Nivolumab, daratumumab.
You're a MM patient,
Yes,
and where do you get your care?
that's at Sloan Kettering.
Okay, yeah.
And I've been on that for a few years now. I'm on my 55th cycle.
Yeah, the triplet therapy in MM seems to be really effective. So good for you.
But just raising some questions, I totally forgot what stage that trial is technically considered to be.
Mhm.
Would like to look up again.
Yeah.
And I assume just by identifying who makes those drugs that I know who's actually running that trial. But the information that I'm provided by doesn't tell me who is running the trial.
Seth, is this your first treatment, or have you had other treatments before this clinical trial?
Well, I had forgive me, a stem cell transplant back in the beginning of 2015. But it was only about 16 months before my cancer started, new activity began. And they were treating me with a single monoclonal antibody, which I can't remember which it was. And that was working so. We would see a few spikes in my activity, and then they decided to try something else. And they offered me this trial. As I said, I believe I've been on it since 2017.
That's great. I was trying to get my neighbor, of course, in Texas, a neighbor lives 55 miles away, but I was trying to get my neighbor down in Robert Lee to join us. She is an MM patient, just diagnosed several months ago, and she has been going to MD Anderson, and she's lining up now to get the stem cell transplant.
I also just add that my cancer is, as they say, very well controlled. Each month when I get tested for my treatments are monthly, and each month when they give me my labs, there is no change in the levels of proteins and that they look for, the markers for activity. And I'm also required to do a bone marrow biopsy twice a year, which by coincidence I'm giving one tomorrow. That's my favorite one. That's my favorite one.
Yeah, those are last.
Get it with sedation. Don't let them poke you without a sedation.
Come on, what's the little pain?
No, it's like a world of difference to get it with sedation, honestly.
They've
The
never
the trouble with
that
was
way.
local, and it was like, nah.
with sedation, I believe I would have to have somebody there to take me home, and I just don't have the convenience of setting that up.
Okay.
And I've become, I've had plenty of these enough already, so it never occurred to me to get it with sedation, and the people who are doing it, they've done a pretty darn good job lately. But
Good.
the important thing is that the results of those have been excellent as well. I was kind of amused that I guess the lab for the clinical trial says they can't detect anything at all. And then the Sloan Kettering lab says, well, we can detect some minor little traces, but otherwise there's nothing. And
So you are having MRD testing as part of that bone marrow process.
I beg your pardon?
So they're testing you for minimal residual disease as part of those bone marrow, and you've been minimal, undetectable.
Undetectable.
Great.
Yeah, I have to be pleased with the results. Absolutely.
Yeah, no, that's great. Yeah.
That's perfect. So is anyone, Lynn, have you been on a clinical trial before?
No, I have not. And I was just looking a while ago at some of them. It appears that we think of clinical trials as being the last resort, but and Thomas might want to comment some more on this, but clinical trials can be for a first-time patient. It really, you need to let your doctor know I'm interested, and you need to have a doctor that is in the know of what's available and what is promising. But some of our long-term people involved in cancer, I'm thinking specifically of Andrew Shore and Brian Kaufman and Terry Evans. Those guys, some of them were in clinical trials way back when, and that's why they're still in here waiting for Alzheimer's to take over.
Yep.
I'm working with a guy right now who got diagnosed with a fairly serious form of bladder cancer at the beginning of May, and his first line of treatment is going to be a clinical trial.
All right.
So, we managed to navigate him to probably the best doctor in the country for this particular cancer. And as it turns out, the trial is either the standard of care chemotherapy versus a combination immunotherapy, and it's randomly assigned. So he's going in and he's hoping he's going to get the immunotherapy.
Great.
And the
Of course-
nice thing that for people who are having financial difficulties, clinical trials pay for all the drugs.
Yes, but they don't pay for all of the hospital fees. So you have
But
to
that's
be
also,
really,
that's tax deductible.
well, but you've got to have the money to make it and the income to make it tax deductible. So this is a very important point, and something that often gets overlooked with clinical trials. But while the drugs are often free, but not always free, they're not always free. The hospitals can charge if they're for the procedures that are involved, and it's a very significant issue for people, for a health equity issue, because it discriminates against people who have less funds. They may, first of all, they've got to be able to get to the clinical trial. And we actually we work with some nonprofits who will offer funding to help you with lodging and accommodation to get to a clinical trial. But they don't help you with the medical fees. And we've had people that couldn't participate, particularly with the renal medullary carcinoma, because they didn't have the money or the insurance to pay for their for the healthcare costs.
Hmm.
Another plus on some clinical trials is that if it becomes apparent at a certain stage that one group is getting treated with a superior treatment, that some of them have a crossover at a certain
Yes.
point where you can cross over to the better treatment.
Right.
Yeah, and another important aspect of clinical trials, which is not always that well publicized, is that you can always pull out. You commit to a
Anytime.
clinical trial and it's not going well, you're not happy, you don't want to travel, whatever it is, you can pull out, as Lynn says, at any time. Now, it's interesting because we've had this discussion in one of our other groups, and one of our moderators runs a lab at the NIH. And when we say that, he gets very defensive. He doesn't like to make it known that he put out. It can be very difficult to recruit for clinical trials. That's another issue around clinical trials. Particularly if you are at a center of excellence, you have to watch out to make sure that the doctor doesn't have a conflict of interest in recommending the clinical trial, because they need patients. And just in the same way, I don't know if it happens that much with the blood cancers, but certainly with some of the other cancers, and certainly with prostate cancer, you have to be really careful that a doctor isn't recommending treatment for the wrong reasons, just to make a few bucks. And so we're very familiar and concerned about that financial conflict of interest. But in centers of excellence, there is a academic conflict of interest too. So you need to keep your radar up on that. Tom, what do you got to say about that? You've worked in a few of these centers of excellence.
You know, clinical trials tend to be focused in the academic medical centers, but you know, as we mentioned earlier, they're available in different sites. So anyway, you know, you can pull out at any time. I mean, it's definitely your prerogative, and they try to encourage you because they want to get the data as long-term as possible. I mean, we're just, you know, ASCO starts tomorrow. The American Society of Clinical Oncology's annual meeting starts tomorrow. And there's 7-year follow-up data on ibrutinib being published as part of this, you know, meeting. So, you know, the more people you can keep in a trial and follow for as long as possible, the better.
I've got 7 years on ibrutinib.
There you go.
Started in April 2014,
Yeah.
2 months after it was FDA approved.
Had you been on another treatment before that?
I had been. I'd been on a combination. Now, I was diagnosed with small lymphocytic lymphoma, but
Okay.
I'm treated with Revlimid combined with Rituxan. And after 3 months, the doctor said, this is not having any effect, and I'm going to change you to a brand new drug, and we'll continue with Rituxan because it probably will help.
Right.
So I probably had 20 rounds of Rituxan before it was all over with. It's about a year later when I quit taking Rituxan. But I'm taking the full dose of ibrutinib, have all along.
Mm-hmm. I did a full dose for about 2.5 years, and then I was having a lot of issues with bruising. And so my doctor said, you're doing well, let's try 280 and see where you go. And I've been on that ever since, you know, so.
I am also on blood thinner. I'm on Coumadin because
Okay.
because prior to being diagnosed, I had 2 episodes of clots in my legs, and so normally they wouldn't be putting you on ibrutinib if you were on a blood thinner. But
Yeah.
at MD Anderson, they referred me to what they called a benign hematologist, and he said, let's do the blood thinner and let's shoot for an INR of 1.5 to 2.5. And that's the measurement, the international, what they call it, normalized ratio that they use to check how effective the dosage is of the Coumadin you're receiving.
Yeah.
So that has worked for me. I've had no major bleeding episodes.
Beautiful. So one of our moderators has been kind of quiet tonight. So Kenny, the jock of multiple myeloma world, I would like to introduce you to one of our new participants tonight, Lorraine Anderson, who is the jockette of the CLL world. So she, like you, is an athlete, a runner, and so she's quiet, and you came in late. So, but the two of you probably can share some interesting information about the benefits of exercise for anybody with a blood cancer.
Sure. Well, thanks. Well, hi, everyone. I know a lot of you here already, so you already know me, but
I think Lorraine is gone.
No, Lorraine's there. She's just she's not on video. It looks like she's muted, so she's just on the phone. But in case you don't remember who I am, I'm Kenny. I run an organization called Throwing Bones for a Cure, and our mission is to encourage blood cancer patients to stay healthy and active through treatment and beyond, and talking about all of the benefits, of course, that come with physical fitness and exercise and purposeful movement, and how it can affect you. You know, Seth talked about well, all the things that, of course, that lots of myeloma patients go through, and certainly CLL people, but specifically a bone marrow transplant. That's pretty brutal, pretty tough. And I've talked to many people actually over the past few years who have said things to me such as, I couldn't have a bone marrow transplant because my doctor said I was too old. And while I think maybe your doctor told you that, it seems unlikely, but maybe he did. But in reality, I don't know that that's necessarily true. Your age is not actually a factor very often. It's your health and your ability to recover from that and to handle all the trauma that you're getting ready to go through with this sort of thing. I think if Jimmy Carter in his 80s can undergo similar procedures and come out of that just well, and still knocking it back and doing his gardening in what is 94 now, 95, in South Georgia, I think probably most of us can handle this, in 60s and 70s even. So that's not true. So there are ways that these things can be discussed, because a lot of us run into a cancer diagnosis already having things like hypertension, high blood pressure, diabetes, pre-diabetes, and other health issues. A lot of times comes from either sedentary lifestyles or not purposefully moving. And people say, well, it's about weight. It's not about weight. There's certainly plenty of people that I know that are insanely active, who otherwise don't fall under that stupid BMI that people pay too much attention to. So I think there's a lot that can be done. And yeah, I've done a lot of stuff for getting ready for this. I've trained my whole life to get cancer. So I'm ready. Let's do this.
Thanks. Maybe Lorraine is.
Tell Kenny about your athletic pursuits.
Well, I mean, I've done quite a few. I started when I was 13 doing endurance sports. I mean, I played sports all through high school and some in college, but team sports stuff. But I started with the endurance sports even earlier than some of that. Cycling, and then I did swim, and I've run, which most people know me for. I mean, I've cycled across the country. I went from San Francisco to DC and down to Charleston, but I've also run across the state of North Carolina. Here in North Carolina, we have a trail called the Mountains to Sea Trail, and currently it's 1,750 miles. And so I ran that in 54 days a few years ago. That was after I had my bone marrow transplant. So it's 2 years after I had my bone marrow transplant. So yeah, there are definitely things you can do. Not suggesting that that's something that you should do, because that's probably a little bit insane. But you can do things. You can be mindful of movement, purposefully moving, and enjoy life. It's all about quality of life, and it's what drives you. And those things drive me. So by continuing to move, I get to keep moving. It's when you stop, it's really hard to get going again. And I know sometimes life just stops us. I get it. Okay. Done that too. I just had an adrenal ectomy back in January. I kicked my butt. It was hard. It was tough. Somebody cutting into your abs. You don't realize how much you rely on your abs for everything: sitting up, coughing, sneezing, laughing, and that's really painful to do after somebody's been cutting into it. But you know what? 2 weeks after, or less than 2 weeks after I had that adrenal ectomy in January, I ran a marathon. So, and then 4 weeks after that, I ran another marathon. Or 5 weeks after that.
What's an adrenal ectomy? What is that?
So removed one of my adrenal glands. So you have two. I had a tumor, and I cannot, for life of me tonight, remember how to pronounce it, but it was a maybe Tom, you can, something
Did you have pheochromocytoma?
That's the one. I had that tumor sitting on top of my adrenal gland. Which
I am so super impressed that you ran a marathon 2 weeks later. Tell me, how did you do that? It's hard enough to do when you don't have a problem. How did you heal? Was it a special food that you ate, or what did you do?
No magic. I just, I hurt. And so again, probably not the suggested or recommended part of recovery. And no special food or whatever. I mean, one thing I did do is that I trained a lot knowing that I had surgery coming up. So I had I'd gotten my long runs up to about 22, 23 miles before I had to go in for surgery. And so, because then I did nothing until the day I went and ran it. And then I also went really slow. That was probably the slowest marathon I've ever run. So,
And do you feel that afterwards it was, something that you were really, because I've done a couple of marathons, but each time I've done it, I've never trained the way I wanted to, because I always had these medical problems. Even before I had the cancer, I had other things that I was always dealing with, blood clots and whatnot.
sure.
And so there was something always stopping my training. But when I would finish it, it always felt so rewarding. Now you have a completely different story. Since you're a young kid, you're quite the athlete. And so I don't know if you had the same experience, because to me, I didn't have that. I was later in life, and so I'm so new at it that it's such an emotional thing for me. So I don't know, like, what did you get out of the marathon? Is it still emotional when you've done so many, or?
Oh yeah, well, especially with that sort of thing. And thank you for calling me a young kid. It's only in this group does anybody refer to me as young. I'm 50. But, my oldest child is 20, so that doesn't happen frequently for me. So thank you. But
My oldest
yes,
child is probably older than you, Kenny.
You're what?
My oldest child is probably older than you. She's 48.
Yeah. Well, it's all relative, I guess. As we get older, it seems like we all get closer in age, doesn't it?
There you go.
But yeah, it absolutely gets emotional. In fact, actually, when the year after the year after I had my transplant, my bone marrow transplant, I started running again, and I actually had to stop for a while. And I have myeloma, so for those of you who are non-myeloma folks, one of the many negatives that comes with myeloma is often people have bone issues. Seth, I don't know if you had any bone stuff too, but I've had 2 compression fractures in my spine. My scapula looks like it's sort of chewed up dog ears. I've got a hole in my hip, which was the one they were most concerned about. In my collarbone, skull. They hit a lot of small bones, some of my ribs, things like that. So I kind of got holes everywhere. So they shut me
You are
down.
amazing. I just want to tell you that you're a beacon of hope. Thank you.
Oh, thank you. Well, thank you. I think one of the things that kind of got me through that is because nothing changed. But as far as me, right? Because I was used to pain. Sorry, 1 second. My daughter's beckoning me. Yes, dear.
Hello.
Hi.
Oh, she's so cute.
Good thing she doesn't look like her dad.
All right.
Lorraine, do you want to come back with your video?
Bye, guys.
No, I'm in and out of. I have trouble regulating my body temperature. I'm just hiding right now because I'm in and out of changing, wardrobe changes.
Oh, heavens.
Sorry about that. When you have a 17-year-old, I do actually make her tell me what she's doing anymore. Even if it is the summer. But to follow up to finish your question, Lorraine. So I was going to tell you that the year after I had my transplant, I got back to running again. And in 2016, even though in 2015 I didn't run, I ran 2 races that year. I ran 3 races that year early in the year. And then when they found out the extent of the fractures, I didn't even realize I had broken parts of my back. I do a lot of things, as you might have gathered, that might make me hurt. And so I really just assumed I just pulled things. And when it came to my back, I was just trying to muscle my way through it. And I did. In fact, I ran.
Terrifying. Oh my goodness. Wow.
Well, okay. It sort of started to heal itself. I don't mean to be blasé about it. I'm not being humble or anything. It's just it is what it is. And I think that maybe that was a really good lesson for me. And wasn't being a hero for trying to work through some sort of a pain. I'm just used to that's part of the process to get to the good stuff. Is that sometimes you got to feel a little pain to get to the good stuff. And I think that was valuable for me personally, and hopefully sometimes that's something I can relay to others, is that you really do often have to go through the fire in order to get to the really sweet spots. And I think that's not true for us. I mean, as individuals living with cancer, whether we're on maintenance or we're on active treatment or we're in full remission, I think a lot of times that's a part that we either we don't recognize, we don't forget, or we don't even want to believe. Because I hear
That was
often,
beautiful.
this is not
Thank
the, I don't think this is not the group that I think that that normally would do this, but I hear frequently, and I know you all do too, where people lament the fact that they're dying, that this is just horrible, and that all the negative parts about whatever our disease is, about how bad life is, and they forget to realize that it's life and it's good. I mean, and there's great stuff, and part of this is just being, just living. And so we can really get bogged down into forgetting to do that sometimes. And so much of in 2016 was that verification, that validation of that for me, or at least the beginning, because I did 16 races in 2016. I did 3 in 2015. By the end of the last race I ran was my longest race of the year, and it was an 18-mile trail race that was about 7,000 feet of vertical gain, total vertical gain. And it's a hard race. It's called the Shut-In Ridge Trail Race. And some of the elevation climbing on that is just brutal. And I've run it before, by far not my best one I've ever done in any respect. And I'll never get that again, I don't think. I mean, partly, again, if I didn't mention I'm 50. So I've long since passed any sort of prime. But it felt awesome. I can't even tell you. I cried.
Aw, I love it. I love it.
I got to Mount Pisgah and I cried. I mean, I bawled. And that was probably, because there was a cutoff. Because again, it's a tough race, which means that the organizers, who are friends of mine, I mean, it's a pretty tight in the ultra running world, of which I'm a part of. Even across the country, it's a pretty tight knit group of folks, right? And so in that kind of a race, which is kind of it's a really tough race. You want to keep people safe, and so you have cutoff times. If you're not here by this time, we've got to cut you off, because either you're going to be cutting close to either sunset or weather, or we don't want to have people on the course to come get you, blah, blah, blah. All sorts of stuff, right? So I barely hit cutoff, so I was like second to last, I think, in that race, and I've never been that behind in any race ever. But everybody waited for me, and that reminded me that that's how I live. So, and it's enabled me running and being fit and doing other things, even through the times when I haven't felt as good, as it's made it all possible. And so, I mean, seriously, I mean, it's made even the little stuff I've got going on, which is pretty big stuff, like kids and running this organization and doing other things that bring me income. It wouldn't be possible if I wasn't purposefully, intentionally moving. Seriously, because I've coached for years, either fitness or running. I mean, and I've been an active cross country coach for a long time, coaching kids in how to do what I do, but do it for life. And it's given me a new perspective. So, in a way, and I'm not I don't try to overuse the word blessings and so forth, but I got to tell you, I've got a lot of them, and maybe sometimes myeloma is one of them. Maybe breaking my back was a blessing, because it brought me to the point where I also got to meet you, and I get to hang out with you guys and get to tell you about my stories of all this stupid stuff and that I've either done or I'm going to do. So I'm supposed to be going to Badwater in a month, Death Valley, California.
Oh my goodness, that's so exciting.
Yeah,
Have you done it before?
I haven't. I'm not running it. I'm supposed to be crewing for a buddy of mine who ended up just dropping out today. So we're actually trying to get on with another runner. He dropped out because his wife got diagnosed with cancer. Not sure why
Oh
he's out
no.
of the race, but that's his story. So, and not mine. So, but you know what? I'm still going to go do it. I'm going. So one way or the other, I'd like to go out there and recruit for somebody, but if not, my buddy Dean and I are going to go out there and we're going to go jump out of an airplane and go see Lake Mead from a bunch of feet up, and then fall, and then hopefully somebody will stop us from falling before we get too far. But you know, that's part of living too, for me, and that doesn't have to be everybody's story. It doesn't have to be. What's the country song? You know, the skydiving. What I forgot the rest of the lyrics. Rocky Mountain climbing or something.
So while someone is like going to cue that up for us, Kenny, or perhaps sing it. Maybe I could sing it for everyone.
Yeah, All right, go and go.
But yeah, I think Al's going to do it with me, right, Al?
Yeah.
Colorado, Rocky Mountain High. I've seen it rain and fire in the sky.
No, Al needs a Tom Jones song. I just want to tell you what Al needs is a Tom Jones song, and then he'll be right with you.
Oh, man.
Do-do. Isn't that how they start? Do.
The
So
latency with
Sally's going to
video
sing.
creates a problem when trying to sing and harmonize. Solos work fine, but duets go crazy.
Sally, you're going to sing?
No, I'm not going to sing, but I was going to have an adjunct to what Kenny was saying because I am the polar opposite of Kenny. I cook. I don't run. I am not athletic. I can't sing either if he can do that. But something happened to me 10 days ago that absolutely forced me to exercise way beyond what I've been able to do in the last 2 years. And that was the postponed wedding of my niece in Indianapolis, which meant getting from Santa Barbara, which is not easy to get to and from, to Indianapolis and back. So I did that, but I discovered the hardest part was living with my brother, whose entire house is nothing but stairs. I think I don't know how he designed it, but you step up to the kitchen, you step down to the living room, you step up 4 steps up into the house. But the worst part was the bedroom was 8 steps straight up. And if I forgot something up there, I had to determine, is it worth it going up and coming back down? Because I hadn't done 2 steps in a row for 3 years. Because not only because of my knee replacement, but because of the multiple myeloma. And like Kenny, I have bone lesions, but mine are in my fibula and my left leg and my back. So after 4 days of not running, sometimes crawling on my hands and knees up those 8 stairs, or just hanging on to the railing and pulling myself up, my God, I feel better.
Good for you. That's wonderful.
Yeah, that's fantastic.
And so I'm home 10 days now, and I've gone out. I live on a very, very steep hill, and I've actually gone up and walked up the street. Not very far, but I've walked up the street and I've walked down and not been afraid. And, you know, it just proved that I can do it. I mean, I was so exhausted. I can't tell you how tired I was, but I'm learning to, you know, listen to my body that if I had to sit on the 4th step and rest for 10 minutes, I did, but I got to the top of the stairs because that's
I
where
am
all
so
my drugs
super
were.
proud of you. This is wonderful.
Sally,
Yeah,
it's
right. No,
so
that's
good, and I just want to say to you that so often when we have people going through chemo and we say to them, and they say they have terrible fatigue, and we say, but you can just get out, even walk for 15 minutes. Oh, but I don't have the energy. If we get them to do it, they come back and they say, I feel so much better. And, you know, it's so counterintuitive. We just ran a study, a survey amongst our prostate cancer folks that we're going to actually turn into a poster for a conference in the summer. And one of the results was that 60% of the respondents said they had either changed or increased the amount of exercise they did as a result of attending our virtual groups. You know, which is fantastic because we hammer this message home all the time. And when I hear you saying that, it's just, it means the world to me because now you know, and you don't have to push yourself. You don't have to be a Kenny. But if you just go out and you do that every day, 10 minutes, and before you know where you are, it'll be 15 minutes and 20 minutes, and you'll feel so much better. So God bless you. I'm so proud of you.
Yeah, no, that's awesome, Sally. That's just absolutely fantastic. And that's one thing that I remind people that even actually pay me to help them work out and fitness. If the base rule is that you don't start out training for a marathon by running a marathon. You start by going to the mailbox.
Well, and Kenny, I'm 25 years older than you are as well.
Sure. I mean, there's all that too. But again, regardless, you still have the ability physically to improve regardless.
Yep.
And I know you know that. I'm not telling you something you know. But and it's 100% a mindset. And I get sucked into that mindset sometimes too of what Rick was talking about. When I do not have the energy to go do this. I hurt. I feel bad, or I'm exhausted. You know, I can't get up. I can't go do this, and that's a tough one to compete when it's inside your head, and you've got nobody else cracking the whip. So that's a tough one doing it. I mean, so honestly, and I mean this absolutely genuinely, the fact that you don't have somebody else cracking the whip for you and it's 100% on you, is even 10 times better because working out, exercising, training, and I know Rick knows this too from his years of cycling. It's mental. It's not physical. Just about everything when it comes to fitness and with athletes in general, it's 100% in your head. It's what you convince yourself that you're capable of. And that's it. So open yourself up to the possibility that I can do more than what I think I can do. That's it.
Thank you
So-
for that. That's
Gears a little bit here. And so, Ashley, when you first joined, one of the things that you mentioned, and we were really right in the height of COVID, was how difficult it was for a young person with blood cancer for dating and relationships. So now that things are kind of normalizing a little bit, are things getting any better for you? Has things changed? Do you feel like you can date again, or what's your situation?
Well, I have a boyfriend, so I don't have to I don't have to deal with that. But it's kind of, you know, we want to like go out and do things, but I'm immunosuppressed, and it's not exactly clear how the COVID vaccine works on blood cancer patients.
Mm-hmm.
So I'm not like, we can go to a restaurant if they have outdoor seating. I'm okay with that, but I won't eat inside. It's too risky for me at this point.
Mm-hmm.
But
Like-
I mean, it's good that things are opening up, definitely.
Yeah, and you're in North Carolina, so there's a fair number of places that have outdoor dining, and the weather is hospitable enough to
Yes.
allow that. I know for a fact that, you know, I am like the bad boy poster child for COVID antibodies. So I had 3 Pfizers and a J&J, and I still don't have any antibodies. And so, it's scary, but, I have eaten indoors, but it's in a place where there's like 25% of capacity and the nearest table to you is 12 or 15 feet away. So I won't go in, I choose not to patronize a place where it's crowded. And, and it's just like, there's little annoying things. One of our people on one of the CLL groups has posted a picture yesterday with a mask and it says, I have cancer. And I thought, I need to get that thing so people kind of get it. It's like, I just traveled from upstate New York in my camper down to my house in Florida. And it's like, it's annoying. Some guy comes in and there's like 6 urinals in the men's room. And where does he stand? Right next to me, not 2 or 3 down the line. And he's got no mask on, and it's like, so it's like people are inconsiderate and I don't know how we tell them that we're special, but it's really difficult.
Was it Sue Wolf Agostino?
Yes.
I think
Yeah.
had-
Yes, her daughter made it special.
Yeah,
She had a mask that says, I have cancer. But when you're standing at the urinal, your face is towards the wall and the guy won't, I need to put it on the head.
You need a headband, Tom.
It's
true.
too bad it's come to that,
Yeah,
We need to have some kind of public service campaign out there.
yeah.
If I have on an orange mask, I'm special.
No, yeah. Your
So,
article, Michelle, was very, I'd like to print out your recent article and have it to hand out to people so people would not be so ignorant.
Oh, Michelle's article is great. Yeah.
Yeah,
Thank
was
you.
really good.
And when I was really inspired to write the opinion piece. It was just like, I was like, I just can't take this anymore. It was like one thing about the antibodies, then it was like mask mandate lifted. Just when I was starting to think, okay, well, I can go to Home Depot outside. I can go to, a garden supply store. Maybe that's about the extent I did.
Right.
But once we get to a lot of, if people are vaccinated, I can eat outside maybe with them, whatever. But now it's just like, I'm back to fear. So
Yeah.
it's,
We don't have any eat-in restaurants yet. We're on major. I live in the COVID hotspot of North America. What a claim to fame. Really, it was in the New York Times, that's where I live.
Yeah.
spot.
So Brian Kaufman shared with me a clinical trial of an injected antibody product that supposedly has long-term protection for COVID for those of us that didn't create antibodies. Now they're not allowing people in that have had the vaccine, but I did correspond with them, and they told me that they expect that sometime during the month of June, they will open it up to us. People at high risk that have had the vaccine and didn't get antibodies. So if for those of you that follow me on my webpage, I'll keep you posted and about that development, and hopefully I'll have some information at next month's meeting to share about that study. It's a 50-50 shot that you're going to get the antibody because it is a placebo trial, but I'd rather take the chance of getting a 50% chance of getting the antibody.
I got the antibodies.
Did you?
What was your number, Sally?
One was over 250 and the other said over 0.08. There were 2 different tests.
Which one did
They
you
don't
get?
give you a real number. They just say it's either over whatever test norm is.
Which one did you get, Sally?
I got both of them, whatever they are.
I think there were more than, not everyone maybe guess the same because I had two, but one was to see if I had COVID or not, and the other was the antibody test. So maybe Sally
Yeah,
got.
no, I've had that one too, but I've had 2 antibody tests and 1 did you ever have COVID test.
Which
And
vaccine did you?
I had Moderna.
The results on my test provided by LLS was negative antibodies.
Yeah, me too.
Mine was, one of my tests was LLS.
Oh, okay, that would explain it. So the LO, yeah, the
Yeah,
LO.
I had 2 antibody tests too, one by my doctor and one by LLS. And the one by the doctor was not as thorough, I guess you would say, because the LLS one was greater than 250 antibodies, whereas the one that my primary doctor did, which was, like a couple of months earlier, so maybe they didn't have the technology yet or something, I don't know, but my doctor said that was the best test he knew, like it was the only test available to test me. It just said that I did have them. It didn't quantify it.
That was exactly my experience as well. My doctor's test to the normal lab said I had antibodies, then it was over the norm, and then LLS came back and says over 250.
Right. Yeah, we had the
Mine said
same.
under 0.4.
You know,
Uh-oh.
I never heard of anyone having over 250 yet. Like, I've heard of people's, but I've heard of up to 250, but I haven't heard over. So you two are kind of like superstars here.
So there's been a couple, there's been some other tests other than the LabCorp test. So LabCorp apparently caps it at 250, but there are some other tests out there that are like
LabCorp.
tests. And I've seen some values of like 2,500, 1,800. So, but nobody knows for sure what do we need to have protection. So we're all in that.
Yeah, no one can tell. I've interviewed a ton of CLL specialists. I don't know about Tom, you probably have too, and talked to them that they don't know how to interpret them. And also they're finding just because I may have antibodies today, I may not tomorrow if I was to be tested again, which is so, yeah, it's kind of like, why bother getting tested?
Yeah.
But it makes me feel better.
Yeah. So I don't think I've been on a call before with Jim Marshall. So just want to introduce myself and hear a little bit about Jim. Jim, what do you have what's your blood cancer?
Well, anyway, the blood cancer isn't really a blood cancer. I don't know, because in about 2017, I was diagnosed with the prostate cancer.
Okay.
And it was found essentially in the lymph nodes within the back. Okay, the big ones. So anyway, I've been on essentially a therapy, it's ADT it's called, and with androgen deprivation therapy now for about 4 years, okay, at the thing. And so exercise is essentially a big thing for me. I mean, exercise is like absolute every day, essentially on the bicycle. So anyway, I'm interested
in the lymph nodes.
Yes, eventually it will probably rear its ugly head. And so I'm trying to figure out exactly what should happen to me. Okay.
Mm-hmm.
So actually, technically, or the VA has me as also having then a non-Hodgkin's lymphoma.
Okay.
So that's okay.
Yeah, and so those of us that are CLL,
okay,
that is a form of non-Hodgkin's lymphoma, and there are others. So so we're in that unique position that we have a non-Hodgkin's lymphoma, but we also have a leukemia. And so the fact that yours was in the lymph nodes is interesting because usually, prostate is pretty localized unless it's metastasized outside.
Yes.
And then the lymph nodes are those that are usually closest, to the prostate, not up in the back area. So interesting.
Right.
So yeah, so we're glad to have you, and hopefully, what we talk about here may be of use to you in the future.
Absolutely. Also, out of this thing, I have a sister who was diagnosed about not quite a year ago, okay, on the multiple myeloma, and I'm trying to get her to join this thing.
Right.
But that's going to take some effort. I will have to twist her arm because of the fact I think that she would be a great person for this because she's like 68 and had, I believe, a transplant. Well, excuse me, a stem cell thing about 3 months ago, and she's having some difficulty, especially with the doctors in I believe,
Jim?
Oklahoma. Tulsa.
Jim, I'm a coach if you need some help.
I know. I have been trying to get her to contact you. My sister's a little stubborn at times, but she said, well, I'm so busy. I said, look, you need a coach. Trust
Aren't
me.
all sisters?
Huh?
Aren't all of our sisters
Well,
stubborn?
not all of the sisters. I have another one, anyway, who is also a little bit stubborn, but not quite as stubborn. Anyway, it's interesting to hear all of this stuff, especially with the terminology, because eventually I think it will be extremely important for me. So I will be around, hanging around.
We welcome you.
Thank you very much.
So I think everybody's had a chance to talk. Does anybody have any
Ashley
other?
was going to share, she has a hip replacement coming up, and some of you are about to have them, some of you have had them. So Ashley, how do you feel after all you've been through? About this coming up, and do you have questions for those who are old pros at it here? Or young pros?
So my hip replacement is on the 29th. This will be my second hip replacement. I guess I'm not surprised because I knew it was going to happen. I'm just more like annoyed that it has to happen. But it is what it is, and I'm looking forward to being able to walk like a normal person again. And I don't know, hopefully it should go better this time because last time I had it, I was 6 months out from transplant and I was a lot weaker. So hopefully it'll be much better this time.
Is the reason for your hip replacement something to do with your cancer? What kind of cancer do you have and how old are you?
I had ALL and I'm 32. Yeah, so I had a vascular necrosis because of the high dose of prednisone I was on. So I had it in both hips, and that's why I needed to. So I replaced my right hip, and this time I'm replacing the left.
Wow. Oh my goodness. You are such a warrior. Oh my goodness. You're amazing. You're
Thank
amazing.
you.
Look at you. Ah.
How long ago was the right hip?
It was in 2019.
Okay.
So
I
it'll
had my,
be yeah, it'll be 2 years, and I guess in October.
yeah, I had my left hip done in, well, because I'm very romantic, I had it done on Valentine's Day 20. So, you know, but that was the first day it was available that I was available. And so here I was, a newlywed. I had just gotten married in October of 2016. And my first Valentine's Day after being married, I had my hip replaced. But it got me out of pain and it got me out of limping and all of that stuff. So it went really, really well. And I was up and about in no time at all. And the doctor told me the best thing about it is, as Kenny and Lorraine will tell you, is walk, walk, walk after the surgery. And that's what got me through. 3 days after my surgery, I was walking a mile, mile and a half a day. Not all at once, but, you know,
Wow.
there and walking 4, 5, 6 times a day and just up and down the sidewalk until with a walker. I felt very old at the time, but hey, I got it done and it happened. So you're a lot younger and hopefully a lot stronger, and you'll have a really great outcome.
Yeah, thank you.
Prednisone's a shitty drug.
Yeah, so I'm supposed to get off of it on Tuesday. So
Okay.
that's exciting.
Forever and ever, or
Hopefully.
yeah, that'd be
Not
great.
just in preparation for the surgery.
I didn't hear you. What?
Like you're going off it to make the surgery experience better, or off of it?
No, I was supposed to come off of it anyway. I just went for a consultation with my orthopedic surgeon, and they, x-rayed my hips. I've been having a lot more trouble over the past month, and they said, "Yep, this is severe. You got to get this done."
So we'll be thinking of you, our next
Yeah.
meeting. So that'll be just before our
That'll
next.
be just before.
Tom,
Yeah.
what's the difference between Dex and Prednisone?
They're essentially both steroids. They're both corticosteroids, and it's just a matter of the dosing. But there's a table that we use to switch somebody from one to the other. So essentially, they're equivalent.
So why wouldn't, if prednisone has such terrible side effects, seemingly worse than dexamethasone, why don't they use dexamethasone instead of prednisone?
But all the steroids have the similar side effects.
Oh, okay. I'd never heard of those terrible ones with Dex.
Yeah, salt and water
Prednisone
retention and
counter-
a lot of other things. Yeah.
Myeloma, isn't it?
We
Like
just
a lot
say
of them-
deadly Dex.
Tom,
No.
isn't prednisone contraindicated with some of the maintenance chemo for typical Revlimid? I think with Velcade and with Revlimid, I think prednisone is contraindicated.
I'm sorry, but I couldn't hear that.
I said I think that prednisone indicated for Velcade and Revlimid.
Off the top of my head, I can't tell you for sure.
I know Dex is a that helps Revlimid do its job, so that's why we take it. So
Yeah.
Michelle, I have a
So
quick comment.
Yes, I was just going to ask you if you wanted to share, Lynn.
I do have a quick comment. Like I mentioned earlier, 7 years on a ibrutinib, and it's I have the usual side effects, but still going along with that. Next visit to MD Anderson will be in August. But this week I went and had my annual visit to the dermatologist, and I insisted on the full body scan because as a blood cancer patient, we have a higher risk of secondary cancers. And normally they just yawn when they look at me, brown eyes and whatever else it is that I don't have dark skin, but I don't have light skin either. but he did burn 4 places off, one on my hand, 2 on my face, and 1 on my ear. And he said they were all precancerous, no biopsies required. I asked him what they would have turned into if they'd gone untreated, and he said probably squamous cell. But anyway, that's I just say this as a way of, and it wasn't a terrible experience. They used the liquid nitrogen, which to burn it off, and I did have some pain afterwards, but it was gone probably within 45 minutes or so. But it's certainly something that we all need to keep an eye on. One of those sort of things that could get us, kind of like colon cancer. You don't want to neglect what the doctors recommend.
Mm-hmm.
That's
How
very,
often do you go for the skin cancer check? I was told to go every year, but then I don't know if I read it in the CLL group on Facebook, but somebody was saying every 6 months, their doctor said. And that seems, if we're supposed to be at a much higher risk, particularly for skin cancer, maybe it is a better idea to go every 6 months, or is that crazy? And we could just monitor ourselves and kind of look as well and kind of know what to look for.
Yeah, I go every 6 months. That was the recommendation. So, I'm treated at Moffitt, but my dermatologist is across the street at the University of South Florida. But my dermatologist previously had been on the staff of Moffitt, so he's used to dealing with patients with cancer. And so his recommendation was every 6 months. And I'll go one, like my last treatment, they biopsied one spot between my toes and they froze one spot. The time before that, there was nothing, but I just get a lot of peace of mind. No, knowing that I'm getting that twice a year check. And like Lynn said, a full body check, and then they look at everything. They pull up your hair and they look between your fingers and between your toes. I mean, obviously they found a little spot between my toes that was suspicious. It's interesting. My late wife's husband died from melanoma that started on the bottom of his foot, and his family doctor thought it was a plantar's wart.
Huh.
And so, it's really important to see a dermatologist and to have this. But, melanoma is, used to be a death sentence. It's not anymore, but it's still not a great cancer to have. So the earlier you can get it, the better. But skin cancers are, you're more likely to die of, those of us with CLL are more likely to die of a skin cancer than we are of CLL.
Thank you. That was very helpful. I think I'm going to call tomorrow and schedule the 6 month.
There you go, Lorraine.
well, so that's the place where we may have to advocate for ourselves. And I just made a note to myself because I am actually going to the dermatologist next week I'm having some kind of reaction to something, but I'm going to ask if they'll do that because they only have me on every year check. And my
Yeah.
father had malignant melanoma. So I need to be pushy for the 2
Yeah.
reasons and advocate for myself that they do check me more often. And as Tom said, they do check between everything when you get a good exam. So it is really important for all of us. And so Debbie, this is your first meeting. Are you still with us? Hopefully we have not put you to sleep over there. I'm not sure if Debbie is still listening or not, but I wanted to ask Debbie if you are, if there was anything you wanted to say before we sign off tonight.
No, it's nice to meet you all. And I'll look forward to keeping in touch.
Well, I hope we see you next month. It's the first Thursday of every month. So
Okay.
that is, I don't have my calendar open. July, does anyone have their calendar? July, let's see. That will be on July 1st.
July 2nd.
No,
First
July 1st.
So that will be our next one. It's always the same time. It's always the same, actually. And Debbie, I think Rick has your email. Is that right?
Yes.
Okay. So you'll be getting an email reminder. There'll be skywriting over your house reminding you. We do that for all new members. Everyone noticed that. And yeah, Tom called in some favors for that one. And for everyone else, I hope you stay healthy this month and remember to tell other people. Jim, hopefully your sister will join us. And anyone else, if you have anyone you want to invite, please do. Ashley, best wishes on your
Yeah.
surgery. Thinking of you. You know where to
Thank
find
you.
us if you're like up late for whatever reason on your drugs and you're lonely. You know where to find us on July 1st.
Okay.
Do we have Lorraine's email? Lorraine,
Yes.
have you? We do?
Yes, I have it.
Okay. Okay.
I will share that
Thank
with
you
you.
so much, everyone. This was a really wonderful first meeting for me. I'm looking forward to the next one. Thank you, everyone.
Thank you, Lorraine. Have a good
Nice
night.
to meet you, Lorraine.
Bye.
Nice to see everyone. Take care.
Yes, it's great to see
Bye-bye.
everybody.
Okay. Bye-bye.
Bye.
Ashley, let us know how you're doing. Tell us how you're doing. When's the surgery? What date?
It's on the 29th.
Okay. Well, the 29th, so on the 1st is only a couple of days later. So you don't have to
She'll
let
be
us
there.
know.
She's a warrior.
I may be, drugged up. We'll see. I don't know.
You'll be fine. I've got
Long as
flu
you have
as
enough
well.
for everybody
We
to
don't mind
share.
if you're drugged up. That's all right.
Hopefully they give me the good drugs.
The good drugs.
Give me the drugs, right? Okay. Bye. Bye.
Thank you.
Bye.
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 All right.
Bye.